So, coming to the most important section of diabetes mellitus is the treatment of diabetes. So, the treatment of diabetes is very, very important and can be done on regular basis by taking oral agents and by injecting insulin. So, it's a disease that can be controlled by all these medications unless and until the patient contributes on a same level. So, foremost, the most important thing is that the sugar is controlled. So, glycemic control is very necessary. This control should be done between 80 to 100 milligram per deciliter, not more than 100 milligram if you're talking about the fasting glucose, and then having an HbA1c level of less than 7%. So this is the target that is supposed to be done, and after assessing the patient's HbA1c on a regular 3 months basis, it's very necessary to see that the level is below 7%. Now, coming to the treatment, it's very necessary to educate the patient regarding the disease, to explain him about all the complications and the way of his lifestyle, and to educate him to a level that he understands the complications of diabetes mellitus and then ultimately contributes on the same level. So, having a very balanced nutrition and having a balanced diet is very necessary in patients with diabetes mellitus, as to avoid going towards complete obesity and also not having a reduced weight. So, having a balanced diet is also important to educate the patient with. Exercise is very important in diabetes mellitus. Having regular exercise, either strenuous exercise or even have to walk for an hour. So, this sort of exercise is also very important. And lastly, home glucose monitoring is also one of the key features in the treatment. As you all know, that monitoring the sugar on a daily basis gives you an idea if the sugar is being controlled or not, and having a complete data of the sugar in a week to assess and predict the clinical diabetes mellitus. So this is very necessary to keep monitoring the sugar levels. So, the pharmacological therapy. Now, coming to the agents that are given to the patients orally, we'll be talking about these in detail. The drugs includes, foremostly, the biguanides. These includes metformin. Metformin is the drug that is the most common that is given towards to the patients with diabetes mellitus. It decreases the hepatic glucose production, and the glucose absorption from the GI tract, and it increases the utilization of glucose peripherally. So this is one of the drugs. Second being the sulfonylureas. This includes the glipizide and the glyburide, glimepiride, and lastly the chlorpromazine. So these are the insulin secretagogues. So these are the drugs that are also given with metformin to patients with diabetes mellitus. And then thirdly, the thiazolidinediones. These drugs includes the pioglitazone, the rosiglitazone. These drugs are usually given to enhance the tissue sensitivity of the insulin in the skeletal muscles. So the four most important drugs includes the meglitinides. These includes the ripaglinide, natiglinide. These drugs are given to rapidly acting insulin, and these are also the insulin secretagogues. And then coming to a class of drugs which includes the alpha glucosidase inhibitors. This includes acarbose and miglytolol. This kind of drugs, they usually slow the gut absorption of carbohydrates. And then coming to the drugs called the DPP4 inhibitors, these include the sitagliptin, the saxagliptin. And then coming to the last classification, which is the incretin mimetics. These include exenatide, pramlintide. So what usually happens is that these drugs are given on a combination level, But it's also very necessary that the patient should be aware of the potential risk and the clinical benefits of these different types of drugs, as they may induce hypoglycemia and other sorts of complications. So now coming to insulin. Insulin is the most powerful tool for the management of diabetes mellitus. We'll be talking about the different types of insulin that can be injected to these patients. First being the rapid acting, these include the Lispro, Aspart, and Glulisine. So these are the rapid acting insulin that are given to the patients. This is usually approximated around zero point 0.1 unit per kg of the body weight per meal. So, for example, if a patient who is 100 kg in weight, the man would be injected with 10 units of rapid acting insulin, which is usually 15 minutes before the meal. And then, if we talk about the short acting insulin, these include the regular insulin, and this is usually given in combination with the rapid acting and the short acting. So, it's usually given in a combination, and it's given in a basis of percentage, which is sometimes 50-50 or sometimes on a 70-30 sort of a percentage. And then we've got the intermediate insulin. This includes the NPH. And lastly, we've got the long-acting insulin, includes the glargine and detamir. So these are the different types of insulin, and it's very necessary that patients who have uncontrolled diabetes, they're not being controlled with oral agents. So as long as giving them oral agents, they can also be given insulin in an injectable form, and this is usually helped in reducing the sugar level and controlling the glycemic control. So this brings us to the end of our lecture. We've talked about diabetes mellitus. We've talked about the different clinical features, the different types of diabetes mellitus, and then we've talked about the diagnosis and the treatment of diabetes mellitus. I hope you've enjoyed our lecture today. Thank you for watching sqadia.com.